Hi, my name is Morgan. I'm a psychiatric mental health nurse practitioner student at Old Dominion University, and today I would like to educate you on depression. First, we're going to talk about the pathophysiology of depression, and then we're going to talk about how the pathophysiology relates to symptoms and treatment. So to begin, depression can be caused by a lack of three chemicals in the brain. Cases may vary, meaning that a person could experience a lack of one chemical or a lack of all three. The chemicals include serotonin, dopamine, and norepinephrine. Now, I know those words may sound unfamiliar, but don't worry, I will explain what they do and how they work in the brain. Serotonin is the main chemical that's studied, and when the brain doesn't have enough of it, it causes issues with mood, sleep, digestion, nausea, and sexual desire. Dopamine is the feel-good chemical. It's what makes us feel good, have motivation, motor function, arousal, and reward. Norepinephrine helps regulate mood, anxiety, energy levels, and attentiveness. These chemicals are very important, and some relate to others in the symptoms they may cause. Now we can talk about how that pathophysiology is related to the symptoms that they cause. A decreased level of serotonin can cause symptoms related to digestion and nausea by causing a lack of appetite. Symptoms related to sleep include too much sleep or not enough. A loss in sexual desire, which may be an activity previously enjoyed, is something that's not enjoyed so much anymore. Decreased levels of dopamine may cause symptoms that include recurring thoughts of suicide associated with mood, a loss of interest in enjoyed activities, or resisting to try to engage in those activities related to motivation, arousal, and reward. And it can also cause a decrease in motor function. Having a lack of norepinephrine in the body may cause the inability to concentrate and difficulty or inability to make decisions due to a lack of attentiveness. Not enough sleep may be associated with anxiety, and too much sleep may go along with disinterest in previously enjoyed activities and low energy levels. Low energy levels can also be related to a lack of energy from not having enough norepinephrine in the brain, which also relates back to getting too much sleep. A lack in all three chemicals can cause feelings of worthlessness if there is not enough of the chemical in the brain. Now, that doesn't mean that you have to have all three of those chemicals in the brain, or a lack of all three of those chemicals in the brain to experience that feeling of worthlessness. You can experience a lack of just one of those chemicals in the brain and still have that feeling of worthlessness there. Now we can talk about the treatment and how pathophysiology relates to the treatment. Treatment for depression has a range of different medications. Antidepressants help to stop the depressive symptoms by increasing norepinephrine and serotonin in the brain. The two main types of antidepressants are SSRIs and SNRIs. SSRIs are selective serotonin reuptake inhibitors, and SNRIs are serotonin and norepinephrine reuptake inhibitors. Now, I know those sound very confusing, and you might not be able to understand them, but don't worry, I'm going to explain exactly what they do and how they work in the body to help you get those chemicals up to normal levels. These medications help by blocking the body from reabsorbing the serotonin after it carries its initial message, meaning all of the feel-good symptoms, and allowing there to be more serotonin in the brain to carry more messages that help you to feel good and have a positive mood. So normally when your body carries that initial message, the serotonin is absorbed into the body. But this medication allows that reabsorption to stop so that you have more serotonin available in your body so that your brain can have all of those happy feel-good symptoms again. And there's more serotonin available to deliver more of the happy messages. Now, I know that was a lot of information, but please let me know if you have any questions, and I will also leave you with an informational brochure so you can further educate yourself. Thank you.